Welcome back to another edition of What's Next? Living Longer, Better, Smarter. This episode, Finding Help for Your Health, is made possible by VividPix.
Don't let your memories fade due to the passage of time or cognitive decline. VividPix Memory Station and software makes it simple to scan photos, documents, and mementos, restore these images, record voice narrative describing these memories, and share these wonderful memories with stories.
I'm Fred Fishkin along with Mary Furlong. Hi, Mary.
Hi, Fred. Here we are in March, our own March Madness. Time to get ready for spring. And that seems to be when everyone wants to get healthier, right?
It is, and we have some guests today who are focused on helping us to do that. We'll have some great resources to pass along for Medicare recipients that might even save you some money. But first, something new your phone can do when it comes to your health. We want to welcome the founder and CEO of Sparrow Bioacoustics, Mark Opowski. Hi, Mark.
Hi, Fred. Hi, Mary.
We're so happy to have you with us on the podcast, and we can all learn about your interesting company and innovation. So you have given it an interesting name, right?
Well, I mean, everyone is familiar with the idea of stethoscopes, and listening to your heart and lungs is synonymous with good proactive health and staying on top of, some of these diseases that affect, so many of us, like cardiovascular disease or pulmonary disease. So quite simply, we made the idea of a modern medical grade digital stethoscope possible and put it in everyone's pocket who's got a smartphone.
And this is called the Stethophone.
It's called Stethophone.
Step us through how it is used.
Quite simply, it's really all about convenience and having a medical device with you all the time. So there is nothing to charge or connect or maintain or have to ship to really anyone. So it's just the download of a piece of software onto your phone. You can get it in the App Store. And once you've downloaded it, you can start the software up. You basically hold the phone then to your chest and hit record, and it will record the sound of your heart or lungs, depending on which you specify. And then it creates a medical output that you can share with your doctor, with both enhanced audio and visualizations of your heart and lung sounds.
Let's take a look at a little video demo as well here.
Стетофон, як сучасний медичний виріб для аускультації звуків грудної клітини, може сприяти дистанційній діагностиці пацієнтів. А це є особливо актуальним в умовах ведення воєнного стану на території України.
That is so impressive. Mark, tell us how this came about, and also what do cardiologists think about it?
Well, I mean, the genesis of the idea came from the fact that almost everyone in the company has been either a patient or a caregiver and has had some sort of cardiac condition or cardiac concern. These diseases, in particular, affect almost a third of Americans and are the leading cause of death in many cases. So it's important that we wanted to do something at scale. So we wanted to see if we could take something like listening to your heart and your lungs and move it out of the clinic and into the home environment so that people could be proactive. It's also important that many of these conditions, particularly in the early onset, have symptoms that come and go or aren't always there. So you might feel shortness of breath or little palpitations, or fatigue one day and you're not quite sure what's going on, even if you're not in a high-risk group, it can be important to capture those signals about your heart or potentially other conditions, and then later share them with your doctor when you go see them. And we think that's going to have a very big effect on early detection and possibly even prevention and better care for people who are at risk of cardiovascular disease.
Is there something though that was the impetus for you deciding to do this? Something, anything personal or
Well,
anything?
I mean, I have a personal story in that about 5 years ago, I became suddenly and extremely ill and spent some time in a coma with multiple organ failure. And coming back from that, especially when you've never really been sick before, really makes you think differently about how you want to spend your time going forward and how you want to spend your life. And I'd done other companies in the past and had some success, and I wanted to do something different that could potentially help a lot of people. And the other folks at Sparrow Bioacoustics have all had very similar experiences. And so we got together what I think is an excellent world-class team to really go after this problem in a new way, but in a very scientifically sound way at the same time.
All it takes is an app, huh?
All it takes is an application. And we think at this point, we can become one of the most scalable medical applications available. And we think that is a way to really help move the needle on this issue that just seems to be getting worse and worse in our population.
And with telemedicine, I mean, that's the first thing that comes to mind. How big of a role could this play? I mean, people are seeing virtually medical professionals. They have no way when you're doing that to listen to your heart or your lungs. Are you going to enable that?
Absolutely. We think it's very important. Well, telemedicine is still forming in many aspects of our lives, and exactly how it's going to fit into people's lives still remains somewhat of a work in progress. But in the meantime, if we have the ability for people to capture heart and lung sounds medically at home where it's quiet, particularly when they're symptomatic, and share them with doctors and potentially specialists that they aren't necessarily close to, we think that brings the convenience factor and the timeliness factor into focus for the patient and generates better outcomes. We've been doing work in countries like Ukraine, where we were also cleared by their health authority, and we've had some excellent telemedicine results that have generated vastly better outcomes for patients who, for instance, couldn't easily travel to their local cardiological institutes.
Tell us again how people can find you, and also how the financial end works. What are the costs?
Right now, we are on the Apple App Store in the United States. We are an FDA-cleared Class 2 medical device. And as far as we know, we're one of the only FDA-cleared Class 2 medical devices that is a software-only stethoscope. And so we're very excited to have as much early feedback as we can get. The financial side, we're still working out. We offer a free trial naturally, and we're experimenting with different low-level pricing modules that we can offer to people. And we're still going to be getting feedback and seeing exactly how this fits in their lives and where they assess the value, but also how we can get it to as many people as possible. So we're not going to let price be an issue.
And how are the cardiologists reacting to this?
Well, cardiologists come in all different shapes and forms. Generally speaking, I think any cardiologist that you talk to is going to say that early detection and faster detection is probably one of the key things to preventing people from progressing into things like ischemic events or early heart failure or other sorts of things. They all know what the statistics are. So from the perspective of being able to detect early, I think cardiologists are very much on board. Having said that, we're not here to replace any of the current tests in the diagnostic pathway for cardiologists. Maybe that's something we can help with in the future. But for now, we're very much sort of a front top of the funnel product that helps people get into the system with more data that they can bring to both self-advocate and to help their doctors help them.
Well, I really like that because, I check my steps every day. This would be another thing you can check.
People might wonder, you're on iOS.
Yes.
What are the plans to introduce an Android version?
Well, the plans are there. You're going to have to watch this space. All of these systems and processes, all the systems and processes we go through are very rigorous to release any medical product. And we're going through those steps now with other operating systems and on other devices.
The website?
The website is stethophone.com. You can also reach us at sparrowbioacoustics.com. They go to the same place. There's plenty of information there for anyone who's interested.
So, Mark, great to have you with us. And Fred, you have another guest today with some very helpful information.
Mary, our guest is Rebecca Kinney, Director of the Office of Healthcare Information and Counseling at the Administration for Community Living. Hi, Rebecca.
Hello, thank you for having me today.
Well, thanks you so much for joining us on the podcast. Medicare and understanding plans and benefits can be pretty daunting, I think, for a lot of older folks and their families. You and your team are working to make it easier. Give us the overview.
Yes, that's what we try to do. So I oversee a program known as the State Health Insurance Assistance Program, also known as the State SHIP, SHIP. And this program is a federally funded program that supports a network of over 12,000 team members nationally at the local level to help people with Medicare, their families and caregivers really understand their Medicare options and choices and help them get enrolled in a plan or a set of benefits that work best for them based on their needs.
Tell us why the state by state effort is necessary here, that it's not just one big office in DC or someplace.
Yeah. So it's really important to have this local help for a couple reasons. One being the way the Medicare Advantage plans and the Medicare Part D plans are set up, they're offered through private insurance companies, but their packages and options are based on local health coverage indicators. So Medicare Advantage plans, for example, are different based on your county and zip code. And so what is available to somebody in one county will be different from somebody that is in a neighboring county. And so having somebody available through our program with the SHIP is important to help understand those choices and what is happening locally. Also, networks are different, the providers that are available, and where people are getting their healthcare coverage is different based on where you live. And having somebody who is local to your community that understands how that network works, challenges, good things, all of that is helpful in trying to match what your needs are locally and individually with the plan options that are available. And another element of this is if somebody has limited income and assets, they might be eligible for programs to help pay for their Medicare. There might also be state-specific programs to help pay for their prescription drug costs. They're known as state pharmaceutical plans. That is very localized to each individual state. So it's important to have folks that understand what is happening locally and in your state help you navigate all of that, because somebody at a national level isn't going to have those details for all the 50 states and DC and our territories. And so that's why we have this program that is based locally so that they can have all of that local information and understanding available to help folks.
Terrific. Well, step us through, if you can, how they work with people who are Medicare beneficiaries, what the process is.
Yeah, so for a lot of our programs, when you contact the local program, you will likely do it through the phone, maybe via email, and you can set up appointments. A lot of our programs offer in-person assistance, so you can set up an appointment to go to their office. Sometimes we do appointments at local libraries or senior centers, and really sit down one-on-one with a trained, certified Medicare SHIP counselor to talk through your needs and your options and challenges. We do a lot of help with navigating enrollment decisions, plan decisions, which plan to enroll in. But beyond that, we also help get people connected to programs that might, if they have limited income and assets, might help them pay for their Medicare. We also help with billing issues. So we've got, for example, ambulance. There's just an article in NPR recently about ambulance costs in area ambulance. SHIPs can help navigate that. If you get a bill and you don't understand, it wasn't covered, or you have a copay, or it looks funny, the SHIPs can help you really look at that and understand what's going on and help you navigate those things as well.
And this is an unbiased service as opposed to the numbers that you see on the TV call now for information, right?
Correct, correct. Because this is a federal grant-based program, it is free and it is unbiased. And so Congress actually created this program for that reason, so that there is an unbiased local help, folks that are not associated with any insurance companies, to be able to really talk through all of the options available, regardless of which company or insurance company you might be looking at enrolling in. And so it's important for folks to know we exist. Agents and brokers can be a great resource for information, but a lot of them are only going to be able to talk about the plans that they have contracted with, as opposed to the SHIP program, which is available and able to talk about all of the options that are available to you.
And what are the most common issues or questions that people have? My assumption is that it's going to be Medicare Advantage or Medicare Supplement, or what do I do here?
Exactly. It is the bulk of the questions we get are really, help me understand all of these different plans that are available. I've got all this mail, or I'm getting all these emails, or I see these commercials on TV, and I'm just really confused. What are my choices? What decision do I have to make? We spend a lot of time helping people navigate that and really match your individual needs, the prescriptions you take, the providers that you like to use, with a plan that will help you ensure you can access all of that, whether you're doing it through a Medicare Advantage plan or a Medigap plan. But we also do a lot of assistance for those. We get a lot of calls. People will call and say, I can't afford my prescriptions. They're too costly, or I can't afford the Part B premium and I need help with that. And we will help screen them for programs that are available to help folks pay for their Medicare. They're in that situation where they have limited income or assets, help them get access to those benefits so that they can reduce their out-of-pocket costs for that health coverage through Medicare.
Has there been more regulation of the advertising during the enrollment period? Because some of the Advantage plans make it sound like they give you everything except a new car.
Exactly. Yes, there has been changes to what we call marketing guidelines for these plans in recent years. The most recent took effect with this last fall open enrollment period, and really limited what plans and third-party companies can say about the plan options, to try to ensure that they aren't misleading folks, and that what they're sharing in those ads is accurate and not over exaggerating what might be available from a plan, and to try to clamp down on a lot of the confusion we were having, because some of the commercials, particularly in the 2023 open enrollment period back in 2022, led people to believe that they were going to get access to things like food and transportation that or just not available to everybody, and was very misleading. So the marketing guidelines were changed to try to stop some of that misleading messaging from getting out.
And I suppose one of the questions is, I mean, you can get all these extra benefits, but then if you have a serious medical issue, do you then have less coverage as a result?
Exactly. Then that's one of the things that our SHIP team members can help with. They can, it's important to explain to your counselor the types of things that are important to you. Like, for example, are you really interested in making sure you have dental coverage? Because that's not something that's covered under Medicare. That's an extra. Original Medicare doesn't cover that. Or is it your prescriptions? What is important to you? And then we will sort through the options that are available and try to match those, and really look at the big picture. Because our team members, a lot of them have been doing this for years, they have a real good, solid understanding on how all of these different plans work and coordinate with Medicare, Medicaid, if somebody is eligible for Medicaid, which helps those with low income, and help people make the best choice for their needs.
And there are some changes that went into effect for this year, right? That many of us may not be aware of, that people can find out about through the offices, or?
Yep, absolutely. So programs are doing a lot of outreach to try to ensure folks know that some of these benefits have changed. For example, in 2023, there is now a cap on the copay for insulin products. Now you will not pay more than $35 per insulin per month for that prescription. It doesn't matter if you use an insulin pump or you self-administer that insulin. You shouldn't pay more than $35 a month for each insulin product you use. That's one big change. Another change is to ensure that vaccines are available. So preventative vaccines like shingles and RSV are now covered under Medicare Part D, the prescription drug coverage, and they should be available at a zero copay. And so that's a big change, to expand the vaccines that are covered on Medicare to ensure that folks really gain access to those preventative benefits that are important for folks to get access to. Another change that went into effect this year is a cap on the out-of-pocket costs for prescription drug coverage. So the cap this year is $3,500. That means no matter what your income or assets are, you should not pay more than $3,500 out of pocket for all of your prescriptions in this calendar year, as long as those are covered by the Part D plan. And so that's a big change too. It really curbs what folks are paying out of pocket for prescriptions. And some folks are on a lot of medications, and some of these medications are really expensive, and those copays can add up. So having that cap can make a big difference.
So where do people go? And let me ask you this first. The outreach that you're doing is kind of early in 2024. The next enrollment period is months away. Why is it important for people to be thinking about all this and become more aware now?
Yeah, well, it's important to be aware of all of this now, because things like the vaccines and the insulin coverage, that applies now. No matter what you're enrolled in, that's benefits you can access now that you might not be aware of. And the sooner you can get those vaccines, like the shingles vaccines, the better, right? Because that's something nobody wants, shingles. So if you can prevent that, that's a good thing to get now. Another piece of that is for the programs that are available to help with those that are maybe struggling to pay their premiums and copays for their Medicare, whether it's their health care or the prescription coverage, you can enroll in those low income programs at any point in the year. And so it's really important for folks to know that if you are struggling to pay for your Medicare, or you have a family member who is struggling to pay for their Medicare, please contact us and we can help screen you to determine if you might be eligible. And if it looks like you are, we will help with that application process. And once you are deemed eligible, coverage starts immediately. And so that's really important for those that are struggling to get enrolled in those benefits as soon as possible, so you can take advantage of that benefit. You don't want to wait until the fall to do that.
Just terrific information. So where do we tell people to go for more info?
Yes, great question. So you can find your local SHIP program if you go to our national website. It's shiphelp.org. That's one word, shiphelp.org, shiphelp.org. And on that website, you'll find more information on the program, but most importantly, you can use our SHIP locator to find the program in your state and the phone number. There will be a web address, but there will also be a phone number that you can use to get to your local team members in your community to get assistance.
Just terrific. Rebecca Kinney, thank you so much for spending time with us.
Thank you for having me.
I think the information about the state health insurance programs can be so helpful to many, many people. Medicare choices can be really difficult to navigate. So this was really important to understand. And the Stethophone has the potential to make telemedicine so much better, allowing medical professionals to remotely listen to what's going on with our hearts and lungs. Another great episode and inspiring.
And we want to thank VividPix for helping to make it possible. Learn more about the all-new Memory Station stories at vivid-pix.com. We want to thank all of you for taking the time to watch or listen. Remember, you can always find us at maryfurlong.com/podcasts. And remember to tell your friends, help us spread the word.